Tobacco control is a big discussion point in the Americas. The PAHO has been working with member countries to look at the legislation and the policies around controlling cigarettes. As you know, we have comprehensive legislation that's coming. The Joint Select Committee of Parliament has almost completed its work. Then it will go on the parliamentary floor for the legislation to be debated and passed. And we look forward to that. The challenge, of course, looking ahead is not just around the legislation, it's around enforcement of the legislation. So smoke-free zones, for example, is something that is in place already, but the truth is the enforcement sometimes is not as it ought to be. And there are methods and strategies that are being discussed for that. Another very major issue around tobacco consumption is the e-cigarettes, and in particular, the dangers of that, but also the use of that among the younger population in our schools. I've spoken publicly about that, and it is becoming almost an epidemic in the Americas, where school children are now accessing these gadgets, these devices, some of them very nicely camouflaged as pens and pencils and other school devices, and are using these within the school environment or externally. The truth is, what it is doing, it is developing these habits, bad habits, and it's detrimental not just to the child in terms of their physical being, but also in terms of their mental and emotional being over time. And this is something that we're going to have to redouble our efforts about. We have discussed that here, looked at some strategies that we're going to have to implement. Included in that is public education, not just to the youngster, but to the parents, to the guardians, to the schools. And you'll hear more about that over time. So a big discussion point here is continuing the thrust around controlling and hopefully eliminating over time tobacco consumption, including the new wave devices, e-cigarettes, that are a big contributor now and are replacing the traditional approach to smoking.